would do is pretty much take a look at their weight, see where they're at, as far as are they within a healthy range, and just kind of get an idea about what have they been doing. You know, what is their current intake? I would really focus on what are their daily habits of eating. You know, do they eat breakfast every day? Because that is something that for sure that all patients want to do is eat breakfast. And typically, if they say no, then I talk to them about the starvation mode that the body goes into. And if you're not eating breakfast and fueling your body, then your body will kind of keep itself running on nothing, and it kind of goes into a starvation mode. People with thyroid issues, you want to make sure they're getting enough protein, because whether you're on thyroid medications or not, protein, you need to have protein in your diet. And so I would talk about lean sources of protein, especially if weight is an issue. So lean beef would be okay, but more so turkey and chicken and even fish. Other sources of protein, eggs and cheese, but with the cheese, I would talk with them about how they would need to vary their intake based on when they were having their medicine, because cheese is a good source of calcium, and calcium can interfere with the interaction of the medications. If it's M&Ms that you really want, I suggest have them, but have a small amount. Either buy the small snack packs or be able to take the number that whatever you decide on, and then portion that out almost, because what you're going to have happen is you're going to end up eating the whole bag. But also, if you don't have the M&Ms and that's what you really want, you're going to end up eating so many other things to kind of try to satisfy that it's just better off to eat the M&Ms and be done with it instead of getting all those extra calories from the things that you didn't really want. Eat small, frequent meals. That would be something that is very important to be able to regulate your blood sugars and not be able to be hungry and full and things like that. Keep more regulation. And that's where I start with a lot of patients that would have thyroid issues is, what are you doing now? You may be eating a lot more carbohydrates than you should be anyway, so let's talk about switching some of those calories into protein. We would do that if someone didn't have a thyroid issue, and just learning how to take what you eat now and maybe just portion it out better, so you can just, in moderation, you want to be able to fit it in so you can do it over a long period of time.